But again, the assumption was that if we made ourselves better, if we became legitimate, that the public would support us and we would solve all these problems. Now that hasn't actually come to pass, as we all know. And there was a political climate, you know, the mainstream political climate has never been very nurturing of our kind of generalism. It's always been a bit against the grain when it comes to, you know, equal pay for equal services, when it comes to privileges. Even though we're the third largest specialty, we're a bit on the outside. We've you know, lost some hospital privileges, and that's a big subject for debate. We did some things to ourselves. You know, a lot of family physicians were eager to give up obstetrics, and they used that opportunity to do it. We have enthusiasts who are doing obstetrics now in the discipline, but most are. We're less involved in the hospital of the nation now than we were. We've become a kind of an office specialist. So there were some things we did to ourselves, but there were other things that changed that we had no control over. And one of those is that the ownership of medical care facilities became corporate. You know, the people who lamented the cottage industry soon got into work to manage care. And it's always fascinated me that the word HMO, or the letters HMO, which nobody knows hardly what that even means now. And I think it probably doesn't mean anything. But originally it was Health Maintenance Organization. This was a liberal idea of organizing a package of health services for the poor for a single rate. And a congressman from Topeka, Kansas was one of the sponsors of this, a guy named Bill Roy from Topeka, who's probably still around. Is Bill Roy?
I don't know.
You know the name?
I know the name.
Well, there was a congressman from Florida, and Bill Roy, who wrote and sponsored the HMO legislation that enabled physicians to package services and give a group rate. Well, that was immediately seen as an opportunity by industry. I mean, that broke the barrier for corporate practice. Nobody saw that in advance. I remember going to a Blue Cross meeting in Topeka about the cost of my prenatal workups, that I had to itemize the services of the prenatal workup, and I wanted to package it. I mean, it was a very small amount. But they turned it down. They didn't want me to itemize. They wanted me to itemize. They didn't want me to, you know, to put it in a package. And at that point, we were in the county hospital seeing lots of poor people where that might have made a difference. But what has happened is that the ownership of the medical care system is now in corporate hands. It didn't quite reach the limits that its enthusiasts predicted. They talked about 300,000 firms needed to be reduced to 20 firms. Well, I don't know what it is. It's not 20, but it's some smaller number than 300,000. And so physicians became employees. And that really changed things. So my feeling is that from the standpoint of the ideals of medical practice, that family physicians have suffered a lot more from the industrialization of corporate ownership than we ever suffered from fear of the government. Whether this is, controlling your fees and your records, the requirements of corporate capitalism are a great deal more stringent than the requirements of the government. The ability to exclude patients from practices, to direct them, the vertical arrangements. So that probably limited our growth. And I think we never really changed our politics as an organization. I'm speaking now of the Academy of Family Physicians, which is the political arm of the specialty. I don't think they ever really bought into some of the reforms that were going on. They grabbed hold of the reins. They supported the development of the residencies, but they didn't take leadership in creating the kind of political climate in which family practice could survive. And now I think probably some of the things that you worry about is paying back medical school loans and what constraints, reimbursement packages have on where you practice and so forth. So that has had a limiting, the medical care system is biased toward procedures and the people who do procedures. So we're at the bottom of physician earned incomes in 1968, and we're still at the bottom. We make more money than I made in 1968. The most money I ever made in a year in practice was $53,000. But I thought I was on Easy Street. I took 7 kids to the Dominican Republic for a Christmas holiday on TWA. I was making $1,000 a week, and loving every minute of it. So, I have a gastroenterologist friend who talks about a couple $1 million. I remember a doctor's room conversation once at St. Francis, where a cardiologist from the Wichita Clinic said it's unethical for a doctor to make more than $100,000 a year. Well, that's obsolete and ancient, but that was one of the, there were doctors who had a lot of money, but there were not any rich doctors who got it practicing medicine. They got it from some other source until the procedures came along, and then we introduced a whole new level of, we introduced a new level of management. And the big people who make the most money in medicine nowadays is not doctors. It's the people who operate managed care firms. Hospital administrators, we're still not in that class. So, what are we going